We need to change the paradigm for CRPS and chronic pain patients. We're asking doctors to treat complex regional pain syndrome, CRPS, without training them to do it or even providing them with information on viable treatment options that they can recommend to their patients other than pharmacology or durable medical equipment. In medical school, CRPS gets very little, if any, attention. Think about that for a second. There are very few hours dedicated, often effectively zero, as a standalone topic. Typical exposure in MD programs in most U.S. allopathic MD curricula, or what are they teaching? Dedicated CRPS instruction, usually 0 to 2 hours total, and often not explicitly labeled as CRPS. If you look at integrated teaching, CRPS is typically embedded with broader modules such as pain physiology that could be 5 to 15 hours total, but yet CRPS may only get 5 to 15 minutes of that. In neurology blocks, CRPS may be mentioned briefly when they're talking about peripheral nerve injury discussions. When we look at musculoskeletal or rheumatology, sometimes short case mention. And in anesthesiology or pain management, if that's their specialty, whether it's optional or elective, it may include a 30 to 60-minute lecture or CRPS discussion. In clinical years, exposure depends heavily on the rotation. Primary care and internal medicine, minimal to none. Neurology, occasional exposure if a patient presents with CRPS. Pain management, it could be 1 to 3 hours of meaningful CRPS-focused learning. So across a full MD program, typical students not taking a pain elective or a primary focus or specialty in pain management may only get 15 to 45 minutes of total exposure to a CRPS conceptually. Students with a specialty in pain medicine or pain management may have 1 to 4 hours total, but that's still fragmented. In key structural issues, CRPS falls into a gap between disciplines, often considered low prevalence and high complexity condition. Therefore, they're not putting an emphasis on it. So what happens? It gets missed or misdiagnosed, or proper treatment is not available because it isn't effectively understood. Then we act surprised when outcomes don't improve. This is not a doctor's problem, it's a system failure that we keep ignoring. And until we admit that most clinicians and physicians were never trained to recognize or treat CRPS properly, and they don't have access to the knowledge for viable treatment options, we're going to keep getting the same results. In addition, we need insurance companies on board to provide access to evidence-based treatments that go beyond symptom-based treatment protocols. Let's look at spinal cord stimulators. They're the perfect example. Insurance companies have no problem paying for the implant of a spinal cord stimulator, DRG stimulator, etc., that is symptom-based treatment, but they're unwilling to pay for a program that will actually treat the person as a whole and goes beyond just treating their symptoms. And it can help patients gain long-term outcomes, and for some patients, even gain remission. If you look at the cost breakdown of spinal cord stimulators, it's going to give you a pretty good perspective. A pre-op workup will cost the insurance companies $1,000 to $2,500. The temporary leads or a trial When a patient does that, and that's required for all spinal cord stimulators, can be anywhere from $7,000 to $10,000. A permanent implant of a spinal cord stimulator, depending on how many leads or whether they're using a paddle, etc., and the surgeon in the facility, can cost anywhere from $35,000 to $70,000. Follow-up programming can be anywhere from $150 to $300 a visit. And a battery replacement that typically has to be done every 5 to 10 years if you have a rechargeable battery will cost anywhere from $10,000 to $20,000. Insurance companies have no problem paying those costs for something that's just a Band-Aid, essentially. So it's time for change it's going to take all of us. We need to reform the system from the top down, but we also need insurance companies to step up to the plate to pay for viable treatments that are actually helping patients heal. Now, there's a quote from Albert Einstein that's appropriate here. Insanity is repeating the same mistakes and expecting different results. It's time for change. It's time to change the paradigm. An HCT Foundation is a nonprofit, was formed to save lives by meeting the most critical needs in our chronic pain communities and investing in effective treatments and breakthrough research for CRPS patients and those living with similar diagnoses. When patients feel there's no hope and no help available to them, we see suicide rates increasing. Yet when we provide a treatment, a program, or a protocol that addresses them as a whole, physically, mentally, emotionally, and spiritually, then we're providing them with hope and help that they're seeking. And this is a critical step that will substantially drop suicide rates and help CRPS and chronic pain patients actually regain their lives and regain function. We hope you'll choose to walk by our side as we take the strides to make a bigger difference and to have a lasting impact for those living with CRPS and similar chronic pain diagnosis. Please share this. It's going to take all of us to make a difference.